Hello, everyone. Welcome back to another virtual session with Fresh Dental Shadowing. Today we have Dr. Alexandra Otto, who is a pediatric dentist. And whenever you're ready, Dr. Otto.
Perfect. Hi, everyone. Thank you guys so much for spending the evening listening to our session. So again, my name is Alex Otto. I'm a pediatric dentist in Buda, Texas, which is about 15 minutes south of Austin. And today we're going to be talking about pediatric dentistry. So I'm going to introduce myself and kind of tell you a little bit about my background so that you guys know where I'm coming from when we talk today. But I grew up in Florida. I grew up in Naples, Florida, which is the most southwest point of the state, and then went to the University of Florida for undergrad. I studied food science and human nutrition and minored in leadership when I was at UF. Joined the pre-dental ASR group when I was there and started learning about dentistry and really, got excited about applying to dental school. Wasn't really sure where I wanted to go to dental school, so applied and looked all over the place and ended up going to VCU at Virginia Commonwealth University School of Dentistry. I was there from 2009 to 2013 and absolutely loved my time there. Highly recommend looking at VCU in Richmond, Virginia, as you guys are applying to dental school. During my time in dental school, I was very involved in leadership and became the national vice president of the American Student Dental Association while I was in dental school. I'll talk a little bit more about that in a minute, but really great opportunity to get involved in leadership, get involved in organized dentistry, and absolutely loved being involved in that organization. They have some really great pre-dental opportunities, which again, I'll talk to you guys about later. Because of that, I was, not out of dental school a little bit more than some of my classmates because of my leadership involvement. Wasn't quite sure at the end of dental school what exactly, specialty I wanted to go into in dentistry. I suspected that I would like pediatric dentistry, but didn't get a ton of experience seeing kids while I was in dental school. So I decided to apply for a general practice residency. And my hope was to get, faster at all aspects of dentistry, get more experience in all aspects of clinical dentistry. And same sort of thing after dental school, I wasn't quite sure where I wanted to go. So applied all over the place, ended up picking Denver Health Medical Center as my number one choice for my general practice residency. So GPR is a 1-year just general focus practice residency where you just do all parts of dentistry, do endodontics, you do pediatrics, and just try and get faster and learn more about how to be a clinical dentist. Why I love Denver Health is that we did get to see a lot of children. I got to see kids in clinic. I got to go to take children to the operating room. I got a lot of experience in pediatrics while I was there, which was great. At the end of my time there, I realized that I did love treating kids, and it was definitely something that I wanted to do throughout my career. But at this point, I had been in school for so long, 4 years undergrad, 4 years of dental school, a 1-year residency. I was kind of ready to just start working and start paying off my loans and see how it felt to be just a practicing dentist. And so decided to continue to work in Denver. And I worked for about 6 months at a corporate office, hoping that I would see some kids there and that it would be an environment that I liked. Wasn't quite the right fit for me. And so about 6 months into that practice, started looking for other jobs in Denver and found a pediatric dental practice that was looking for an associate. They were looking for a pediatric specialist. I applied for the job anyway and, told them I saw a lot of kids when I was in my residency. If they'd be willing to train and mentor me, I think I could be a great fit. I was really lucky that they took me on, and I was worked in that office alongside 2 board certified pediatric dentists. They trained me how to think and treatment plan like a pediatric dentist and get a lot faster at treating kids and just giving more comprehensive care. Really lucky that I got to learn how to do sedations in that office, which I'll talk to you guys more about in a little bit. And I was also the provider who would do the full mouth cases when we had an anesthesiologist come into our office. So kind of had a mini residency in this pediatric practice in Denver and loved it there. Would have probably stayed there forever, but my husband, then fiance, now husband, got a job opportunity in Dallas in 2015. And so we decided to move down to Dallas for his job. At this point, I'd only been treating kids for about 1.5 years and decided I wanted to keep treating kiddos in the office. And so found another pediatric group practice in Dallas. This practice had 5 locations when I started, and then by the time I left had 7 locations. So every day I'd wake up and go to a different office and work with a different group of dental assistants and different team members, all while treating kids in this setting. And so after about 1 year working with them, I realized for sure all I want to do is pediatrics. There were things that I felt like I could potentially do better if I was the owner of the practice. And so it got to the point where I realized that I wanted to own my own practice. I felt like I had the skill set to do that. And there was things that, again, I feel like operationally that I could help, an office run better if it was mine. My husband, who has an MBA and degrees in finance and management, and I started brainstorming together what it would look like if we maybe opened up a practice together. And I would do the dentistry, he would be the business brains behind the operation. And so this idea started kind of growing in our minds, and it really became something that we wanted to move forward with. At this point, I was still a general dentist, only treating kids. And so I came to the decision that I really wanted to go back to residency so that I could become a board certified pediatric dentist, so that I could be the specialist and know that I was providing the absolute best care to children. And so we decided to apply to pediatric residency. So after working for 5 years, I went back to a pediatric residency program. Same sort of story. I wasn't quite sure where I wanted to go. We were open to going pretty much anywhere. So I applied to pediatric residencies all over the country and just fell in love with the program in Alaska. And so we moved to Alaska from 2018 to 2020, and I completed my pediatric residency program there. Such an incredible program. Feel so lucky. I ranked them #1 and matched there, but just really great experience treating exclusively Native Alaskan children who have one of the highest risks of caries and cavities in the country. And so got a really great experience, got to meet some really incredible people, and had an awesome time there. So the whole time that I was in residency, my husband was learning the business of dentistry and learning where we could start a practice and what that would look like. So we'll talk a little bit more about that, but that's sort of my long version of my background and where I came from an educational standpoint. Some other things that are really important to me that I just wanted to mention. Again, leadership is really big to me in dentistry and so important to get involved. As a pre-dental student, joining the American Student Dental Association as a pre-dental is such a great opportunity. They have national leadership positions for pre-dental students. They have local and state leadership positions. And they just have so many resources when you're applying to dental school that help you make your application strong, and give you some really great tips and pointers. And you just network with so many other great students who are also applying in the same shoes as you, other dental students from all across the country. So very important as a pre-dental, and then also throughout dental school to be a member of the American Student Dental Association. My leadership through ASDA helped transition me to be a leader in the American Dental Association. And so I'm an ADA success speaker, which means that I go to dental schools all across the country and give lectures to dental students on how to find a job and practice management and some other great topics. And I'm also a member of the ADA's Institute for Diversity and Leadership. And so we find ways to investigate how to promote diversity and promote leadership among dentists in our profession. So a really cool group to be involved with. Even as a dental student, you have an opportunity to be involved in the Institute for Diversity and Leadership. So I would highly recommend that you look that up if you're a dental student. I was a general dentist for a long time before I became a pediatric dentist. So I was really involved in the Academy of General Dentistry, which I think is a great association. Lots of leadership opportunities for dentists, especially new dentists as well. And their philosophy is continuing education. And so that's really what's important to them. And so I, through the Academy of General Dentistry, just was awarded a fellowship. So I'm a fellow in the Academy of General Dentistry, which means that I passed a fellowship exam and then did 500 hours of a continuing education. So as a general dentist, I think it's a great group to be involved with. And then last year, I also got inducted as a fellow in the American College of Dentists, which is the oldest honorary society in dentistry, another great sort of ethical-based association in dentistry that I would recommend getting involved with once you guys are dentists. So a little bit about my leadership background as well. So I always kind of like to, again, I have this long-winded story of like where I've been, all the places I've worked. I always like to point out to dental students, pre-dentals, and anyone who comes to shadow me that I worked at a lot of places before I got to where I am right now. So I know it's kind of in dental school and as a pre-dental, I guess my mindset was that I go to dental school and then, I'd open up my own practice right away, or I'd quickly go into ownership in a practice. And that's not always what it looks like. I literally worked at 17 different offices before I opened my own practice. I worked with tons of different doctors, hygienists, assistants. Some of those were in residency. Some of those were, large group practice that I worked for that had 7 locations in that one group practice. So it wasn't really 17 different offices, but worked at a lot of places. And I just think that there's no way that I could have gotten to the place that I am right now without having had all that experience, without working in different kind of practice models and seeing what it was that I really loved and what fit my personality. So I think for a lot of people, we think success is a straight line, but it's just not always the case. And sometimes, you can have a non-traditional path to dentistry like I did, working for a long time before I went back to residency. And just know that any path that you guys take, there's going to be benefits from it. Learn as much as you can. If you need to take a gap year, if you need to work for a little bit after dental school before you decide what residency program you want, that's totally fine. You got to figure out what works for you and what's going to make you, the most successful dentist in the long run. And sometimes that isn't always a straight path, and that's okay. So again, all of that stuff got me to where I am today, owning my own practice. The name of my practice is called Kids Tooth Team Pediatric Dentistry. Again, we're in Austin, Texas, in a town called Buda, which is about 15 minutes south. Really, really incredible community. So feel super lucky. We opened, September 15th of last year. So sort of in the middle of a pandemic, which has been interesting process to open, but luckily the community's been super welcoming of us. We took all the safety precautions and we were a brand new clean office. So I think parents were actually using it as an opportunity if they weren't super happy at their last office, if they had to take a break from going to the dentist and then try someone new out. I think it's actually worked in our favor. So we've been growing a ton, and it's been going awesome and really well, which is great. I just wanted to show you a quick picture of my family. So this is my husband, Tim, like I was saying, who runs the whole business side of the practice. So all day that I'm working doing dentistry, he's behind the scenes setting up marketing events. He's working with our local schools and our PTAs, other groups in our community, to help us get our name out there and so that we can become a leader in our community, which is, to me, a really important part of being a dentist and being involved in the community, is that you're giving back, not just to the children, but, just the community in general. These are our two fur children. Rambo is the golden retriever. My husband named him. And then Bremer is the Bernese Mountain Dog, who is the sweetest, least intelligent dog you've ever met. And so, yeah, those are our two guys, and we take them to marketing events with us, and the kids just love them. They'll just go give them hugs, and it's super cute. I had dreams of them being therapy dogs in the office, but they're just way too poorly behaved and barky in the office. So they're not allowed there, but they do, they show up on all of our websites and at our marketing events, which was fun. Just a quick disclosure. Again, this the whole presentation is just for educational purposes. Everything that I discussed today are my opinions alone, not expressed by any of the groups that I said I'm involved with. And then any pictures that you see, the consent's been given by the parents or the kiddos that you're seeing. And then any pictures that are not my work or that I didn't take, I've given photo credit to. So what we're going to do today, I'm going to give you a quick tour of my office, show you a quick little promo video, talk about what I believe the pillars of pediatric dentistry to be, what sets us apart from others, specialties in dentistry, talk a little bit about what a typical day is going to look like for me. So I've given a couple of these lectures, which some of you guys have probably seen some other ones. So I try and incorporate something new into each of the lectures I do. Some of the questions that you guys have given me are just talk a lot about, serving diverse and underserved patient populations. So I just wanted to talk a little bit today about what I do in particular to help service some of these kiddos. And then a little bit on work-life balance, and then my contact info at the end. If you guys have any questions throughout the presentation, just drop them in the chat box and I'll get to as many as I can at the end. Otherwise, please feel free to email me or reach out on Instagram, and I'm happy to be a resource to you afterwards in any way that I can. Can you tell my friends what you want to be when you grow up?
I think a dentist.
A dentist! That makes me so happy. Good job brushing, girls. Just a cute little promo video for the practice just to kind of introduce us. I hope you get the sense that, we're trying to build a community with the parents and the kids that we see. I think it's such a privilege to be able to treat children in the way that we do and be a part of their lives in this way. So again, we give back to the community a lot. We try and include, parents in some of the activities that we do. We have open houses and lots of fun events. But really wanted to create, we're not just a dentist office. We're part of the community, and we care about, the patients and the families that we see. So that's kind of our goal, to get, that message across by videos like that. But you can kind of see the office a little bit in the video, but just wanted to go a little bit more into the tour. So this is the front of our building, really nice Class A real estate, strip front. It's kind of funny. We have like Cold Stone Creamery, a Great American Cookie Company, a Bahama Bucks, and a Shipley's Donut, like all to the left of our office, and then it's our office. So we kind of joke that it's like the perfect place to have a pediatric dental practice, because it's all the sweets and then us. I had a really clear vision of what I wanted our practice to look like. Again, I worked in so many offices that had just like crazy murals on the wall, and it was like sensory overload to me. I couldn't even imagine a kid walking in and just like having so much going on. So I really wanted to create this serene, just like very calm environment that kids could come in and just not feel like, they're coming into a dentist's office. I wanted them to feel like they're just walking into my living room. I wanted a nice space that parents could wait for their kiddos. They're allowed back in the office and operatories for, any treatments that we do. But if they wanted to hang out in the waiting room and have a coffee, I wanted a nice space for them to do that also. We have a standing reception desk. A lot of dentist office you go to, it's like this huge reception area, and someone's sitting in the back kind of not paying attention. Our receptionist stands up to greet every parent that comes in, helps them check in on our iPads. Our whole office is completely digital, so there's no forms or papers that they have to fill out. So every kind of little bit about our office is very intentional, and like how we wanted someone to feel, and the experience that we wanted them to have when they come to see us. You can also see on this bottom left picture, there's a screen back here. It's this huge interactive, basically iPad. So kids can run back there and play like games on the iPad. They can draw pictures. So kids love that, and they kind of run straight back to that, which is cool. The clinical aspects of the practice, we do have an open bay hygiene concept. And so a lot of pediatric dentists, instead of having closed off rooms to do cleanings and exams, they have something called an open bay. And so you can see those 3 orange benches are set up like that purposefully, because if a smaller kiddo is getting his cleaning done and might be a little bit nervous, they can see that, big brothers or sisters right there next to them getting their teeth cleaned, and they're doing a great job. So that's a behavior management tool that we use, is direct observation of the kid observing someone else having something done. And then it helps them feel a little bit more comfortable with it. I've gotten in some of these sessions, I've given questions about why we have these benches like that instead of traditional dental chairs. And you'd be surprised that, 3 or 4-year-olds, the process simply of leaning the chair back is kind of an ordeal for them. And so I found that I was having like 5 or 10-minute conversations with a 4-year-old about how we're going to lean the chair back, and it's okay, and I promise you're not going to fall. So these benches are a little bit easier for younger kiddos because they're used to them for the pediatrician's office. They just kind of jump on and lay back, and they feel comfortable that way. So for me, it's just a kind of simpler process of getting them in the chair and leaning them back that way. You can also notice that there's TVs above every station, and every station also has Bluetooth headphones. And so kids can like pick out their favorite movie or TV show while they're getting their teeth cleaning or their treatment done, which is another kind of form of behavior management and distraction. It's also nice with the Bluetooth headphones because they're noise canceling. So kiddos who can be a little bit nervous from like the suction in the ear and the noises just feel a little bit more comfortable having the headphones on. And then this top left picture is just a routine treatment room. I have laughing gas or nitrous oxide plumbed into all of my treatment rooms. Most kiddos, we use the laughing gas or nitrous oxide to help them stay comfortable through the numbing process and the treatment. And then the far left picture is my sedation suite. That room's a little bit bigger because I do have an anesthesiologist that comes into our office once or twice a month. They bring all their anesthesia equipment with them. So we need enough room that it can fit all of their equipment. It can fit the anesthesiologist, or any nurses or team members that they bring with them, and then all of my dental assistants. And I also have all of our emergency equipment in that room so that it's a nice, safe space to be able to do our sedations. And that's also where I do my oral sedations and intranasal sedations, which we'll talk about in a minute. But a lot of pediatric dentists do do, more sedation procedures than potentially general dentists do, just because, children have different needs, and sometimes it's harder for them to cope with, just more treatment or all the things that we need them to do to be able to safely provide the care that they need. So we'll talk about sedation dentistry, but that is one of the pillars of pediatric dentistry. So again, these are the other pillars of pediatric dentistry. We are an age-based profession by nature. Again, we see pediatric patients. Most pediatric dentists will see kids 0 to 18 years old. Some will see a little bit older, up to like 21, or certain pediatric dentists will see special healthcare needs, young adults up until like 26 or so. The reason that we're age-based and we're kind of limited by that is that, kids do, a lot of times we have different materials that we use for baby teeth versus grown-up teeth. There's different procedures that we do. So to how we set up our office is just a little bit different. Like my x-ray equipment is smaller. The chairs that we have are just, different shape and size. And so the ways that we set up our office are a little bit different to accommodate that specific age range. A lot of us do hospital dentistry, where we take children to the hospital if they're medically complex or have a lot of dental needs. A lot of the hospitals that we go to are children's hospitals, and they have age requirements. So for us, we want to be able to provide all the care that a child needs. And if our hospital won't let us take a kid, past 18 or 20 years old, it's hard for us to be able to offer the services that some of those individuals need. So those are a lot of reasons that we're an age-based profession. But again, some of us, because not all general dentists feel as comfortable with special healthcare needs patients as we do, a lot of us will see some of those until they're a little bit older. Behavior management is a huge part of pediatric dentistry. Lots of dentists can do fillings, and lots of dentists can do crowns and do these types of procedures, but it's doing them in a way that not only, gets the kid to be compliant with you tolerating, SHOTSs and the treatments that they need, but to have them have a good experience. And so a lot of pediatric residency is based on gaining, more advanced behavior management skills. And a lot of these are just subtle things that, parents don't even really notice, the kids don't even really notice that you're doing, but it makes the child become a lot more compliant with the things, getting them to do the things that you need them to do safely, even though it's something that they might not always want to do. Some of the simple ways that we do that are something called tell, show, do, where, every child that comes in, I tell them, this is the thing that we're going to do. We're going to brush your teeth today. And I show them, this is my toothbrush that we're going to brush your teeth with. A lot of times I'll show them on their fingernail, this is how it's going to feel when we brush your teeth. And then we actually do that procedure. So that tell, show, do, sometimes takes 30 seconds. And a lot of times those are things that my dental assistants will do for me before I even get there. But you can't just go run up to a kid and have them open their mouth and put all these things in there. There's a lot of explanation and telling them what you're going to do so they're prepared for it. I personally do tons of positive reinforcement. I'm telling this kid the whole way through the treatment, like how great they're doing. I'm paying attention to like how still they're being and thanking them for being, thank you for being still as a statue so that we can get this done. Really trying to encourage them to continue with the positive behaviors. Some dentists will do negative reinforcement and voice control where they're loud, and those are just more advanced techniques that just don't really work for me. I tend to do more positive reinforcement and hope to garner their support and help with getting through this procedure that way. So that's kind of just my style. We do a lot of imagery and distraction, helping kids make sense of the things that they're feeling. So again, I never tell a kiddo, like, I'm about to give you a shot. We tell them that I'm going to blow a little bubble by your cheek and it's going to feel a little stretchy and kind of tingly. It's going to feel like there's a little bubble there. And so, and then as I'm doing that, I'm like, can you feel the little stretchy, explaining what we're doing. And so a lot of kids really benefit from that. In addition to doing that, we're also distracting them while we're, blowing the bubble or giving them a shot by, asking them about their favorite movie or asking them, can you see what's going on in the movie up here? Can you hear it okay? So distracting them while we're doing those things that are maybe a little bit more uncomfortable that we don't want them to focus on. And then, like I was saying, direct observation of one child watching another have something done so that they can see that it's an easy procedure to have done and not be as worried about it. Again, special healthcare needs. This is a huge part of pediatric dentistry. Of all the specialties, oral surgery, obviously, you're going to get a lot of them take the same classes as medical doctors do. I think pediatric dentistry, we also have a lot of training in special healthcare needs. And what the definition of a special healthcare needs patient is anyone with a physical, developmental, behavioral, or emotional disability. And so most kids have behavior issues because they're, at a pre-cooperative age is what we call it. If they're under 3 years old, we're not going to expect them to be developmentally able to tolerate or cope with the same procedures that an 8 or 9-year-old could. So those are things that, we learn how to treat them that's maybe differently than an older child. Physical, developmental, those sort of disabilities are things that we get lots of training with, heart conditions, breathing problems, all of these things that we get tons of medical consultations for as a pediatric dentist. And so that's something that I loved about pediatric dentistry is that we really get to work closely with our medical counterparts and talk to them about the conditions that our children have. Like 2 times a day, I was on the phone with a cardiologist, just making sure that it was safe for my child to receive the treatment that they needed to have. So that's something that's a little bit different than pediatric dentistry. And we really have more of a medical background and training in our residency programs to be able to safely provide care for these children. And then, as I mentioned, sedation and hospital dentistry, again, is a really big part of pediatric dentistry. We get a lot of training in oral sedation in our pediatric residency programs. And so in order to graduate from a program, you have to have at least, I think, 25 cases to graduate the program. In reality, most of them do a lot more than that, but I typically do 1 or 2 oral sedations every day. And so that's something when a kiddo comes in the morning, they drink a medicine, a juice that's really similar to like a Valium for adults. And the hope is that drinking this oral medicine helps kiddos be just, again, a little bit more tolerant and accepting of all the things that they have to have in their mouth. I also do intranasal sedations where you spray a medicine in a kiddo's nose, same sort of thing, just to help them stay a little bit more relaxed and comfortable. IV sedation is typically done by an anesthesiologist. And so I do have a pediatric MD anesthesiologist that comes into my office once a month to do the IV sedations for me. And so she places an IV and helps a kiddo be asleep for treatment. And that's done for 3 years old and they have 12 cavities. We would never expect them to be able to, sit in the chair and tolerate that like a grown-up could. Or if they're very, very fearful and nervous and just the routine behavior management that we do just doesn't work for them, then sometimes they need to be asleep. We also go to the hospital. A lot of the children's hospitals require that you're a board certified pediatric dentist in order to get privileges at that hospital. So that's a big reason that, people go back to residency. And that was a big reason for me that I decided to go back, because I wanted to be able to get privileges at the children's hospitals. And all of this training is very pediatric specific. And so we as pediatric dentists do tons more pediatric oral sedations than any other specialist, even oral surgeons. They don't really do the oral sedations in the same way that we do. So all this is very pediatric specific. We, tons of safety precautions to be able to provide this service to our patients. That's definitely something that sets us apart from the other specialties. So what a typical day in my office looks like, I was just going to kind of run through what a normal morning and afternoon is like. So I usually get to the office around 7, check in, make sure everything's clean and take a look ahead at my day. My team normally gets there around like 7:30ish just to change into their scrubs and get ready for our huddle. At 7:45, we do a morning huddle, just review the whole day, any kiddos that are like special needs or anything that might be different today about another day, we kind of go through all together. And then we see our first patient at 8 a.m. I typically do, like I said, 1 or 2 oral sedation procedures in the morning, another 5 or so restorative treatments after that. And that just is like, routine fillings and crowns with the laughing gas. And then while that's going on, we also have the hygiene going in that hygiene area. And so kids will be getting their cleanings. And in between my treatment appointments, I'm going out to check them and do their exams and then go back into my treatment. So we take lunch from 1 to 2. And during that time, I'm not, taking a break. I'm usually networking with other offices, getting lunch with local dentists or other people in the community, finishing my notes, kind of getting ready for the afternoon. In the afternoon, we do a few more restorative procedures, typically, again, with the laughing gas only. With the sedation procedures, kiddos can't eat or drink after midnight. So we don't really do sedations in the afternoon because then they'd have to go the whole day without eating. So we usually only do those in the morning. And again, more hygiene appointments for just cleaning their teeth and checking them for their exams. A lot of parents, especially school age kids, love the afternoon appointments because they don't want to take off school. So our afternoons are usually pretty busy. We close at 5 and then same sort of thing, 5 to 6, I'm just finishing my notes, making sure the office is nice and clean. At least once or twice a week, we're doing some sort of networking event, again, with other dentists or other businesses in our community. And then other responsibilities that you have as a pediatric dentist, you do take call. And so, I'm the only dentist in my practice that my one practice. So if I was the only person on call, that would be me being on call all the time, and I could never go on vacation or do anything. So it's great that Austin has a call group. So I've got like 12 pediatric offices in Austin, and mine all share call together. So I'm typically only on call, 1 week or 2 weeks a year at the most, which is really nice. So that, if I'm out of town or if I have something going on, that there's always someone to cover my patients, which is really nice. I do go to Dell Children's Hospital here in Austin. Typically once a month, I have block time there. Like the first Tuesday of every month, that's where I am. And then there's other hospitals that I'm privileged at that I don't go to as often, but have them just in case there's an emergency and I need to go there. Again, we do in-office IV sedation with a medical anesthesiologist that comes into our office. And I also do in-office general anesthesia with a dental anesthesiologist that comes into our office once a month. So depending on the kiddo and their needs, we use both of those services. So once a month, we shut the office down and do all of those cases. And I'll typically do, 8 to 10 cases in one day where the kiddo's asleep. And those are typically a little bit longer, like 45 minutes to an hour. And we'll do 12 to 16 teeth at once for those kiddos who just have a lot of needs or again are just super fearful and can't tolerate other procedures in the office. As a business owner, lots of networking. I go to, I know all the general dentists in the area, get lunch with them, meet with them, often and see, how I can help take care of their kiddos in the best way possible, and visit with pediatricians, all the other local businesses in town. And then we're really big into community outreach. So we're members of our Chamber of Commerce. We go to all the market and the park events and like set up a little booth there to meet people in the community and, set up appointments. And then we're super involved with our schools here in town and local PTAs and then some other business groups in the area too. So, being an associate dentist is a little bit different where you just kind of, come to work and you leave. Being the owner of the practice is a little bit different experience. And there's just a lot of other responsibilities that are involved that I honestly didn't really even know about until I became a practice owner. So definitely encourage you, if you guys can get any business classes, minor in business when you're an undergrad, I think that would have been something that's really helpful. Again, I'm so lucky that my husband, who has a business degree and finance and management degrees, wanted to do this with me. There's just a lot to being a great dentist and being a successful practice that has nothing to do with dentistry. So as much as you can, do all these other business parts of the practice and learn as much as you can about business, then I would highly recommend it. Just quickly wanted to go over some of the common procedures that I'll do on a daily basis. Pediatric dentists are huge in preventative dentistry. We want to prevent kids from ever having a cavity or having to go through this experience. And so we spend a lot of time, even when they're really young, educating parents about how to take care of their teeth and the things that they should and shouldn't be eating and drinking and doing. So, I see kids as young as 6 months old that don't even have any teeth yet, and I'll do a head and neck screening and cancer evaluation on them. And then just spend, 10 minutes talking to the mom about, if we're going to breastfeed, these are the things we need to do. If we're bottle feeding, this is how much juice is okay at this age. And so we talk a lot about that with parents and do a lot of preventative work to hopefully help prevent cavities. One of our favorite preventative things to do when we're a little bit older is a sealant, which is just like a little resin layer that seals in all those deep grooves and pits. So you can kind of see the dark stains in this tooth. These stains just get more bacteria in them and are more likely to have cavities start on them. So a sealant just kind of seals all those in and protects them. So it's a nice smooth surface for them to be able to clean. We do restorative dentistry, which means like cleaning out cavities and, putting fillings or crowns in there. Composite is the white filling material that we use. So these two teeth here had little cavities in between the teeth. And then this is what it looks like afterwards. I love composite. It's like a beautiful, white, filling material. It looks just like the tooth does. It's easy to use for me. So I only offer composite restorations in my office, the white fillings. A lot of pediatric dentists will still do amalgam or silver restorations, and there is absolutely nothing wrong with that. It's a safe, great material. It just doesn't work as well in my hands and takes me a little bit more time. So I just don't use amalgam in my practice, but lots of pediatric dentists do. And again, it's a great, strong material to use. A lot of people will tend to use amalgam or the silver restorations for special needs patients because it's less technique sensitive and it can be like a little bit wet when you place it, which is okay. So that's still a material that's widely used. We do a lot of zirconia or the white prefabricated crowns. So this is becoming really popular in pediatric dentistry. Obviously, people are not wanting silver fillings on their front teeth. And so the zirconia prefabricated crowns have come a long way in the last like 5 or 10 years. I use a company called Sprig for mine. They're easy pedo crowns, and I really love them. They turn out beautifully. And so the front 4 teeth here, those are white crowns that I placed on a kiddo. I think these other ones are crowns too, but now I can't remember. But they look just like the teeth do naturally. And then this was a back crown that I did. Some other dentists have placed, I don't know, some sort of a silver nitrate kind of compound in the tooth that obviously stained it this very dark color. And so we elected to place a white crown to just make it look more cosmetic and have a better seal with the tooth. We still do lots of stainless steel crowns or the silver crowns. I place these every single day. I think these are an absolutely great material as well. They're easier to place. I can do them really fast. Like, I can place these crowns in 2 or 3 minutes. They're really quick and easy to place. And they just last a long time. So this is a pediatric dentist. We do tons and tons of silver crowns on the back teeth also. We do nerve treatments on teeth if a cavities into the nerve of the tooth. The 2 different types of nerve treatments that we can do are a pulpotomy, where you clean out just the top part of the tooth here, and then you place the crown on top of it. And that's just if a cavity is like just barely touching the nerve and the tooth doesn't hurt. You can do that type of nerve treatment. A more advanced nerve treatment is something called a pulpectomy, where you clean out the whole nerve of the tooth, and then you put a medicine in there, and then you put the cap on top. So depending on how big the cavity is and what's going on with the tooth, we do 1 or 2 of one of those options for the baby tooth if it's needed. And then we do lots of, extractions as pediatric dentist. Routine extractions or simple extractions are ones where, just the tooth is too broken down, the cavity is too big to be able to save it, so we do have to take it out. Some of us will do surgical extractions, and so this one's not surgical because it's already exposed in the mouth, but this one on the left, this extra tooth is basically in the roof of the mouth. And so we have to surgically remove it by going into the roof of the mouth and then taking the tooth out. For whatever reason, Alaska Native children have a higher chance of having extra teeth in between their 2 front teeth. It's called a mesiodens. And so we took out a lot of those in residency, and so I'll do those in practice. Also, because of my general practice residency, I did a lot of surgical molar extractions, so I feel comfortable doing more advanced extractions, which I think is a nice service to be able to offer, these kiddos that need it. So I like doing extractions, and I'll do a lot of those in my office. And then a lot of pediatric dentists will do interceptive orthodontics, which is basically like the early phases of orthodontics before they get braces. Some pediatric dentists will do all the braces and do orthodontics just like an orthodontist does. I'm not as interested in orthodontics and doing all the brackets and bonding, but if that's something you're interested in, there are a lot of pediatric programs they'll train you to do that as well. But the things that I will do in the office are space maintainers, which basically if you have to take a tooth out a little bit early, you put a space maintainer, this little like ring here that has arms that just hold the space of where the baby tooth was. We'll do habit appliances. So if a child sucks their thumb or they have a tongue thrust where their tongue pushes their front teeth forward, sometimes we'll put some of these appliances in that help them stop or substitute the habit for something different. We do extractions for orthodontics. If there's like just not enough space for these teeth to come in, sometimes we'll take out certain baby teeth like these ones here to create a little bit more room and let those teeth unravel and kind of come forward. And then we'll also expose teeth as a pediatric dentist. So this is I used a laser to expose the 12-year-old molar because it just wasn't quite coming in the right spot, and the orthodontist needed to be able to put a bracket on that tooth. So we'll expose teeth for the orthodontist to help move things along. So those are all things that we do to help and facilitate orthodontics without actually, doing the brackets and the braces. A big trend in pediatric dentistry is something called minimally invasive dentistry. And this has garnered just a lot of feedback over the years. And a lot of pediatric dentists are really striving to do minimally invasive dentistry. And the goal with that is to accomplish equal outcomes with conservative and less invasive techniques. And why wouldn't you want to do that for kiddos? Like, you don't want to put them through something that they don't need, or if there's things that we can do to buy them a little bit of time until they're bigger and they can tolerate just more advanced procedures. The goal is not just to get this filling done or get this cavity done at any cost. The goal is for them to have a good experience and enjoy coming to the dentist and set them up for a lifetime of success in dentistry, not to just get it done just to get it done. So I do employ a lot of minimally invasive techniques if a child's behavior determines that, or if I feel like that we can be conservative and wait a little bit. So I'm just going to go into a couple of the ways that we can do some of these minimally invasive things. One of the options is called silver diamine fluoride, or SDF. It's FDA approved as a desensitizing agent. So if there's like a sensitive area on your tooth that the root's exposed, you can paint this on there and it is supposed to help with sensitivity. But they realized that when they were painting it on, it was also stopping cavities. And so as pediatric dentists, we use it off-label to stop or arrest cavities. It does not look very cosmetic. It does stain the tooth permanently black in the area where the cavity is. But the goal is that if we paint this on there, it just buys us a little bit of time. If we have these kids are 1 or 2 years old. If they're under 2, we don't really do sedations on them. And so there's just not a lot of options. If we have a 1-year-old who has cavities, the options are either just holding them down and taking their teeth out, or we can paint this silver diamine fluoride on there. And the hope is that it stops the cavity from progressing, so that when they're 2 or 3 and we can do a sedation procedure and put the white crowns on there, that there's still enough healthy tooth left to do that. And so when you explain it to parents in that way, no, it's not cosmetic, but yes, it buys us some time and it gives us the most options later down the road. I have a lot of parents who are on board with that and okay with it. So these are, this kid on the left is a kiddo who probably was, just nursing throughout the night longer than he needed to be, or just drinking milk all night long. So he had these pretty severe cavities. And then this is some white fillings that I did on him, a year or so later. And same thing here, just those cavities in the front teeth. And then later down the road, able to put the 4 white crowns on there. Icon resin infiltration is a really cool material. And so basically, after orthodontics, kiddos sometimes have these scars on their teeth, as you can see on this left picture, right where the bracket was. All around there's a scar because they just weren't brushing their teeth very well when they had braces on. So this resin infiltration, basically you paint this, one of these things is like a green etchant. So you place a special etch on there. It opens up the pores of the tooth, and there's a special filling that just sort of infiltrates and infuses into the tooth, gets rid of these white spots, and also helps stop the cavity from progressing. So all these areas where you see the really severe white spots, this is what it looked like after I did icon infiltration. And so what's great about it, you don't have to drill into the tooth, you don't have to give them any shots. It's just this like material that you put on there, and it helps erase or stop white spots from forming. This cavity had progressed too much. I did have to do a little filling there, but it really good results. And it's minimally invasive in the sense, again, you don't have to do shots or any drilling. A way that you can place the silver crowns, there's a technique called doing a Hall crown. It's minimally invasive because all you do is you place the crown in the cement over the tooth in the cavity. Basically, the kid bites down and seats the crown into place. And it just, a lot of times it's amazing. It'll just adjust and the bite will be fine in a couple weeks. But the great thing about that, same thing, you don't have to give any shots, you don't do any drilling, and it has a really high success rate in the studies. So like 95% of these are successful and the tooth is retained until it's ready to fall out. So this is great for kiddos who, again, just cooperation maybe doesn't allow us, or they have a medical condition that doesn't allow us to do a sedation and they can't really tolerate the normal way that we place a crown by like getting them numb and drilling into the tooth. This also was really helpful during COVID because there was a while where we were really nervous about aerosols and all the sprays that our dental handpieces have. And so there were some kids that we saw in the beginning of COVID that we elected to do Hall crowns for, because you can place a crown in a single visit. There's no sprays and water. So it was a more COVID sort of safe way to do things before we figured out, what was going to be safe and what we could do. So those are all 3 techniques that I use pretty much every week in my office for certain kids, for certain cases. So yeah, just wanted to talk a little bit. Again, you guys have had some great questions in some of these sessions that I've done, and I've noticed a real interest in how we can identify ways to treat these diverse underserved patient populations. And so I just wanted to touch on it for a second, share my mission and vision of my practice with you guys. My husband and I spent a lot of time thinking about what we wanted our mission and our vision for the practice to be. Why were we creating this office? Not just to be another doctor's office, but we wanted to be different. So our mission at Kids Tooth Team is that we believe that all children deserve the best care in the world by the most well-trained doctors and staff in the safest and cleanest facilities, regardless of their socioeconomic status or geographic location. We can achieve this by creating a pediatric dental home that puts patient experience and safety above all else, an environment where kids love to visit, doctors love to practice, and team members love to work. And our vision for our company and this practice is to elevate the quality and expand the availability of pediatric dental care in our community. So as you can see, I'm passionate about treating these kids that need me the most, no matter where they live, no matter what their financial situation is. One of the greatest things about kids is, like, they didn't choose these lives that they have come into or the situations that they're in. And if we can find a way to treat them in a way that is kind and wonderful, and they have a great experience, like that, just like that's my only goal all day long, is to make these kids love coming to see us and be safe and have a great experience. And so one of the simplest ways that we do that is just we accept Medicaid in our office. And so there's a lot of pediatric dentists that don't accept Medicaid. Medicaid makes it very difficult. They're very complex in the things that you need to do to submit authorizations, to receive payments, and make sure these kids are getting the care that they need. There's a lot of pushback from them about, the services that you feel like are best for that kid that they just sometimes don't want to pay for. So a lot of dentists and a lot of pediatric dentists just won't accept it because it's honestly a huge hassle. I was passionate about accepting Medicaid because I felt like these were the kids that needed to see a specialist the most. And I also enjoy complex cases. And so sometimes those are the kiddos who have the full mouth needs or have more complex care needs. And so I wanted to, be a provider in my community that was servicing those kids. So that's like the easiest way that we can accept that. But I wanted to go above and beyond just accepting Medicaid. I wanted to do more things in our practice that could benefit these kids. So I just wanted to share some of the things that we've done in our community. One of the things that we did is we hosted an open house. So we inclusive and sensory friendly open house for kiddos in our community. The new sort of term that I've learned from our behavioral health therapist is that these children are neurodiverse. So a neurotypical kid is one that's, meeting all the developmental milestones, is a standard neurotypical child. A neurodiverse child would be someone who has like ADHD or autism or, sensory, disabilities. And so we hosted an open house on a Saturday. We partnered up with a local behavioral health therapist and a speech therapist. And those are the two ladies on the right-hand side of that picture, to come in and help us create just an open house for these kids where they can explore the office without having everyone in there. And so we basically blocked off like 30 minutes at a time per child or family so that we could go through the office together, and it wouldn't be sensory overload. There's not a million people, there's not all the sounds, just to introduce them to the office in a really just friendly way that's calm and inviting. And so the first day that we hosted, we had like 10 kiddos come, and it was wonderful. The behavioral health therapist had, she has her own techniques that help kids assimilate to different environments and kind of slowly introduce them to things. So it was really great to partner with her and see how she interacted with these children, to give us advice and help and tips for that. So really cool thing that we did for the community. This was a free event, and that's kind of another, something to note as we're going through this. A lot of these services that we're providing, we're doing so, at the expense of our practice and our business. And there's a lot of things that insurance just doesn't cover, that they don't pay for. They're not going to pay for this free visit where, they come in and I spend my time, going through them and going through the office. This was a service that we provided free to the parents. So these are things that like you're maybe not going to get reimbursed for in your practice. And this is, something that you're doing out of the goodness of your heart. And so, something that I feel passionate about and I want to do. But at the end of the day, you're also a business, and you have to be able to, pay your team and pay your employees and keep the lights on your practice. So it's kind of a fine line of opening your doors to the community and individuals, but still, knowing at the end of the day that you have to make payroll, you have to do these things as a business owner. So it's kind of a fine line that we're still figuring out and figuring out what the key to all of that is. But it's important to me to be someone in the community who accepts these kiddos and provides a safe space for them. So this is, one of the things that we've done, because it's, sad. A lot of these kids, so every time they've ever been to the dentist, all they've been done, like they've just been held down by someone, and they become fearful. And so if we can introduce them to another way that we can do things, to me, that's so rewarding. Austin has one of the biggest deaf communities in the country, which I didn't know about till we got here. And so we started getting some deaf patients from the deaf community in our practice. And a lot of them, we'll use translation services. So we have an iPad that we have a live person come immediately on the iPad to talk to them and communicate with the parents or the patient if we need to. But I wanted to at least like say hi and introduce myself and have my team members know at least like basic sign language. And so we just spent an afternoon at one of our meetings just learning some basic sign language. And so one of the moms in our practice has a deaf son, and so she offered to make us a little video and kind of help train us. And so my whole team just like spent the afternoon learning some basic sign language of how to introduce ourselves. And even if it's, our sign language isn't great, but I just wanted these children and these families to know that they're welcome in our practice and that we're trying. And so this is the mom that was just teaching us like basic things like, again, are you okay? Or are you doing fine? Like I wanted to be able to interact with them as much as I could while they were in the office. And so, yeah, there's certain things that you're legally liable, if you have a patient who's hearing impaired or deaf, that responsible party, you need to be able to provide adequate translation services for, which we do. And luckily Medicaid does also pay for an in-person interpreter, which is great because it's a big difference to have someone in the room helping translate. But again, just like going a little bit above and beyond to at least like know some basic signing so that these patients and parents, felt like that they were welcome there. Are welcome in our office. Another thing we do is we're a community partner with a local organization called St. David's Foundation. They're a really great foundation here in Austin, and they go to a lot of the schools in the area, set up a mobile van, do dental screenings. They'll do simple treatment like sealants and like small fillings on these buses. But the kiddos who have a lot of dental needs that they just can't do everything in the bus, they send to their community partners. So we sought them out, asked how we can help, and like we were interested in helping with these kiddos. And so in our area, if there's a child on the bus that they just can't do all the treatment for, they'll send them to us as one of their community partners. And they've got a huge support system. And so they have lots of donors, and that helps pay for the dental treatment for these kiddos. But yeah, sorry, my doggies are barking if you can hear them. But these are all things that we sought out and looked for. No one came to us with these opportunities. A lot of these things we do, again, out of our own pocket because we want to be able to provide these services. So these are things that, again, if you're interested in helping these underserved patient populations, I highly encourage you to do that. I also highly encourage you to be involved in organized industry and be a part of like the profession that advocates for reimbursement for some of these services. Shouldn't every private insurance, pay for a translator to come and help those deaf patients, but they don't. And all those translation services come directly out of our pocket. Shouldn't we be able to provide care for these kids, in need through the St. David's Foundation? So, these are all things that, again, aren't always covered, but we feel passionate about helping. And there's always ways, these might not directly correlate to you and your future practice, but, look for ways that you can help. And even doing something small like learning sign language goes a long way. So just a little touch on work-life balance. For me, again, loving what you do and feeling like you're going to work every day, being excited, makes it feel like, whatever the quote is, that you never work a day in your life if you love what you do. So be really true to yourself that, if dentistry is the right path for you, that you've done your research, that you've shadowed. You don't want to get into a profession just because someone else feels that that's what you should be doing. So I highly encourage you to learn as much about dentistry, pursue shadowing as much as you can to make sure that this is what you want to be doing. Because again, I love what I do, but I know some pediatric dentists who didn't really learn about pediatric dentistry a ton before they went into the field and just realized after they were already a pediatric dentist that it wasn't the right fit for them. Just unplug as much as you can. Nights and weekends, I try and get off social media and, just unplug with my family as much as possible. And then again, schedule what's important to you. We have to schedule going to the gym, date nights with my husband. Otherwise it just doesn't get done. So important things just as you're getting into in school that just has helped us kind of get through all of this. Just some pre-dental groups that I wanted to introduce you guys to if you haven't heard about them already. I already talked about ASDA. Can't say enough how important it is to get involved. asdanet.org/predental, tons and tons of resources for you. The Summer Health Professions Education Program is another great group. I did their summer session at Columbia University when I was in dental school. Really great program. They help you study for the DAT. They introduce you to dental and medical programs because a lot of us in undergrad, we're interested in both. And so it's a really great way that you can learn a little bit about medicine and dentistry, learn from dental students and medical students, and just kind of get submerged in that kind of environment. So I highly recommend looking into that as well. So thank you guys again. I hope I didn't run too much over right on time, looks like. We took a tour of the office. We talked about the pillars of pediatric dentistry, went over what a typical day is, talked about how my practice services some underserved and diverse patient populations, a little on work-life balance, and then I just wanted to share my contact info. My practice website has a lot of information on pediatric dentistry. I try to make it an educational resource for parents. So I think it's a great place to look and just learn a little bit more about procedures that we do. I also did a day in the life Instagram takeover for ASTRA's District 4 predental group. So if you're interested, you can kind of watch that. And there's some cute like patient interactions and some more shots of my office in there. And then my contact information, we're still new and growing. So any like followers on Instagram and Facebook are always appreciated, and we're grateful for those. Then I also do like educational posts and have lots of cute like kiddos and pictures in my office too on Instagram and Facebook. And again, I'm happy to help. You guys can message me directly on Facebook and Instagram. I manage all those myself. And here's my practice email too, dralex@kidstotheme.com. If there's anything that I can do to help, or if you guys have any questions that we just don't get to today, I am happy to be a resource for you in any way that I can. So thank you guys so much.
Awesome. First of all, thank you so much for such an amazing presentation. That was like so amazing to watch. Like, thank you so much. I actually absolutely love that. And like your office is like goals. It's like so pretty. I love it. So we do have some time for questions. I guess like some of the main questions we have, since you do have your own private practice, is kind of the business side. If you like can answer some of those questions, but kind of just like a broad question would be like, how would you go about starting a business, since this is a business, and like kind of like the basic logistical things that somebody may have to do in the future?
Right. Most people, I feel like majority of people typically either buy a practice out or they become an associate in a practice and slowly become like a partner or eventually buy them out. Those are typically easier processes to do because a bank will lend you money for a practice that's already existing and already has a cash flow. It's harder to do a startup in the sense that like you have no track record, you just like opening the business. And so we honestly probably would have just bought a business if we could have, but there was nothing for sale in the area that we were looking when we wanted to open. So that's why we decided to do a startup. There's definitely some benefits to that because everything's brand new. I got to have the office layout exactly how I wanted it, but then you're starting with like 0 patients on your first day and have to build that up. The biggest hurdle is bank financing. When you come out of dental school, you have a lot of the student debt and loans. And so a lot of banks like just won't give you a loan if your debt to income ratio is a certain amount. So a lot of people, if you are interested in buying into a practice or starting it up, you do have to typically work for a couple of years to either have some savings or have proof of income basically that you can buy this practice. So, I mean, there's a lot that goes into if you are doing a startup or buying a practice, doing just like market research on what's in the area. Are there other dentists in the area? What's the need in this area? There's companies that you can hire to help you to do those kinds of services. Because again, my husband has the business degree and he already knew how to like do the demographic kind of market research on what area we should be in. That's a huge decision of like where you're going to place your practice and make sure that it's like visible and that there's a need for where you are. So yeah, bank financing is a huge part of it. Just so many little details that go into opening the practice. What kind of practice management software are you going to use? All the insurance that you need to be able to run your office, malpractice, disability, just insurance in general for the physical space and building. But yeah, I mean, I could give a whole practice management lecture on all the things that you need to do to start your practice. It's a lot, and honestly, even more than I thought it was going to be, even going into it. So I honestly don't know how dentists do this by themselves. Like, I think that they can do it. I just don't know that they can grow as fast as we've grown, me having, someone dedicated to helping us do that. But yeah, it's a lot and it takes a lot out of you. And, it's just hard to find time in the day when you're seeing patients all day to also manage the business and do that. So because of that, there's a lot of groups called dental service organizations that you can basically hire someone to help manage the practice and do the marketing and do those sorts of things. And so that's a great option for some people. If you want to own your own practice, kind of hiring and outsourcing some of those things that we're as dentists not experts in. And that's why a lot of people too, I think, become associates and end up working for someone else and are happy with that because you can show up at 8 and you can leave at 5 and you have time to spend with your family and time for your mental health. And I think that there's like absolutely nothing wrong with being an associate and working in an environment that's got a great culture and people that, you feel fulfilled working there. So being an associate dentist or an employee dentist is also a great thing for certain people too. So yeah, any specific questions that, you can email me and I'm happy to talk more, but yeah, there's lots that goes into it. Asking business owners, about their specifics is great. And when you are an associate working for someone, observe how they file their claims, how they write narratives for the insurance companies, trying to observe as much of those non-clinical dentistry things as you can, so that when you do, or if you do ever open your own practice, that you're, as knowledgeable as you can be about those.
Absolutely. Thank you. Okay, so the next question kind of has to do with networking. You had discussed a lot of the things you do and just kind of like how does somebody go about networking and just expanding their business and getting more connected with the community for like dentistry specifically?
Yeah, I always, my go-to is like joining your local and state dental associations for the dental parts of it. A lot of them, even just like the best friends that I've made have been from like just the new dentist committees that I've been involved with and those groups. As a, even as a dental student, as a resident, even though I knew that I wasn't potentially staying in these places long term, I went to all the local and state dental association meetings. The connections that you make with other dentists or pre-dental students, even during these times, are so beneficial throughout your career. There's a dental student that I was friends with in ASTA in dental school, hadn't talked to him in 7 years. And then when I realized that we're moving to Austin, I worked part-time while we were getting the office up and running, because most offices with no patients, you're not going to be open 5 days a week. So we were open at my office 3 days a week, and I was working somewhere else 3 days a week. I knew, so during that time when I was looking for a part-time job, reached out to the contacts that I'd made through ASTA, had a friend that was in Austin here that put me in touch with someone else, and that's how I got my part-time job. So it's like as many people as you can meet in ASTA, the ADA, all those organizations. That's a great place to start. And then when you get in town, like your local, almost every city has a chamber of commerce, and that does local business networking groups. Social media has made it so easy to kind of see who the local businesses are in town. We interact a lot with, like, there's a Pilates studio next door, so we like host, co-host events together. Just reaching out to the schools, like I said, is a great way for us as pediatric dentists. But I've become friends with a lot of the other local businesses just through social media, and I reach out to them and I ask, like, I'm giving a thank you gift to other dentists in town. Can I buy your, macaroons, or can I buy whatever to give to those people? And then those are all people who, they're local in the community. They're other small businesses. They talk about us and they bring their kids to us. And so it's been really fun kind of figuring out who the other local businesses are in town. And I think it's about supporting them and supporting the community. And then it sort of naturally happens that they also support you. So we love giving back to the community that way, and like, figuring out how we can support other local small businesses.
It's amazing. I think we have like time for one more question, and then I think we like wrap it up. But the last question kind of has to do with how do you personally or your staff kind of deal with anxious children, of course, like coming to get a dental procedure, but also sometimes parents can be anxious too. So kind of balancing both of them, making sure everything goes smoothly.
Yes, parents are sometimes much harder than the children are. But it's about teaching and training parents too, because a lot of these are, their first time parents. They've never been told like how they should interact with their kid in a dental environment. And so that's something that I do a lot of, like, prep work ahead of time of, like, this is how, these are the things that we can do to help your child have a successful visit. I'm actually created on Canva, the website that I use for presentations. I made a video for parents that I have every single parent watch as soon as they come into the operatory, before I even come in the room. And so my assistants present them with this video, and they say, Dr. Alex says all of our parents watch this. It's just some tips on how we can make this a successful visit. And it just says simple things like, these are the words that we don't say at Kids Tooth Team. We don't say shot or hurt or poke. And like, you think those are all common sense things that a parent wouldn't like walk in the room and say, she's about to give you a shot. But literally like 4 times a day, a parent they would say that before I had them start watching this video. So for me, just like prepping the parents, explaining to them, like, yeah, these are the words that are not helpful to say. Parents think that, they're helping by standing and hovering over their kid and like squeezing their arm right before I give them a shot or injection. And so explaining to them that, like, you standing over your child actually just sends them a message that maybe something bad's about to happen. And so if you kind of just are off to the side and, just are low key about it, then they're going to be less intimidated and less scared about it. the other things that I tell them, you know, and I never say like, you can't participate. I want you to participate. I want you to be here, but, you know, just gently encouraging them and guiding them to help us in ways that are effective has helped a lot. So for me personally, showing them this video that I've made has really helped to kind of, you know, stop some of those common behaviors that parents have. But you can also easily do that just in a conversation of like, you know, it's just, we want you to help us, but if you'll like give us the privilege of coaching your kiddo through this. And, you know, a lot of parents respond really well to that. But it's about teaching them and training them. Parents don't know, or they're not always intuitive about the things that are helpful or harmful in a dental visit. So that's pretty much what I do for parents. And then, yeah, every kiddo, like I said, it's just all about behavior management. And the longer that I've worked, it's like you can kind of pick up cues on a kid pretty quick and know the things that are going to make them uncomfortable or what they may or may not do. And so it's all about, just being sort of emotionally intelligent and understanding like what a kiddo's needs are and what a parent's needs are, and talking to them and figuring out what that is. And so I'm constantly asking kiddos, like, you doing okay? And, you know, like if you need a break, you raise your hand and let me know. And I'm also checking in with parents, asking them if they're okay or if they have any questions. And so I think communicating and being an effective communicator that's emotionally intelligent is really the key to that.
Awesome. Thank you so much. I just want to say thank you so much for that wonderful presentation. Also the question and answer session that we just had, and just in general for like such an amazing, I just like truly, that was such an amazing presentation to watch. So thank you so much. But yeah, so for anyone, they can just reach out here. You can say your last words here.
Awesome. Perfect. Well, yeah, thank you guys so much. And I hope you have a great rest of the night. And honestly, please let me know if there's anything I can do to help.